Hi class, in this recording we're going to focus on the pharynx. So let's dive into it. And we've previously talked about the nose in the last recording for this lecture. So we have the nose up here and the nasal cavity. Now we're going to move on to the pharynx. And this pharynx is this area right here. It's broken up into three divisions of the nasopharynx, oropharynx, and laryngopharynx. And the pharynx allows for us to further process the air that we're breathing in and also to swallow food and drink. So when people talk about the pharynx, they think about the back of the throat, and there's this tube that funnels at the back of our throat, and that it starts wider and becomes narrower as it goes down. So it kind of has an overall funnel appearance, which is hard to see from this mid-sagittal slice diagram. Let's clear the screen here. So as we look at the three regions, the nasopharynx is the most superior, and this is going to be where the auditory tubes from the middle ear drain, and the nasopharynx also is going to contain the pharyngeal tonsils, sometimes also referred to as the adenoids. And after that nasopharynx, we're going to have a sharp downturn towards the next region, our oropharynx. And I typically define the oropharynx to students as the inferior margin of the uvula to the superior margin of an elevated epiglottis. And those are usually the defining lines for me for the oropharynx. And this oropharynx is going to have air, food, and drink travel through it. The nasopharynx should only ever have air traveling through it. Occasionally, I guess if you laugh really hard, you can cough some milk up your nose, but that's an exception. Typically, you don't want to have food coming out of your nose. And as we look at the oropharynx, where we have food, air, and drink traveling through it, the oropharynx is going to contain the palatine tonsils, which are located on the margin, shown right up here. Let me clear the screen. That's really hard to see. So we have the palatine tonsils up there to show you those. And then after our oropharynx, we have the laryngopharynx, the part of the pharynx right next to the larynx, hence the name laryngopharynx, the larynx pharynx. And the laryngopharynx goes from the superior margin of the elevated epiglottis all the way down to the opening of the esophagus. And this is our laryngopharynx, the last region in the back of our throat. So as we look at the nasopharynx, our nasopharynx only has air going through it, and it's going to have that respiratory membrane, the respiratory epithelium, the pseudostratified columnar epithelium. The oropharynx and laryngopharynx, which have food and drink going through them, have a stratified squamous epithelium lining them, and this means that they can resist frictional forces. And as we're looking at the pharynx as a whole, the pharynx has a wide variety of muscles within it, and these muscles are going to assist us in swallowing and pushing food and directing that food down towards the esophagus and away from the larynx by folding the epiglottis, helping us to fold the epiglottis back. And the muscles of the pharynx also are going to allow for us to change our vocalizations, to aid in the formation of speech. Now, after the pharynx, or the back of the throat, we have the larynx. The larynx is commonly referred to as the voice box in common English. And this larynx is primarily made of cartilage. It's a chamber or a container, you could think of, outlined in cartilage. And it's shown here. We have an anterior, posterior, and mid-sagittal view for your learning pleasure. So let's look at this anterior view. The anterior view shows how the larynx has the hyoid bone along the superior margin, and commonly it's the cricoid cartilage that's commonly agreed on as the inferior margin of the larynx. As we look at the larynx, its primary role is to keep food and drink out of the trachea. We don't want to inspire our food and drink. We want to swallow our food and drink. I'm trying to think of a technical term for swallow right now, and I can't actually think of a technical term for swallowing. But we don't want to breathe our food and drink in. We want to swallow the food and drink and send it to the stomach through the esophagus. There is an additional role of the larynx called phonation. And phonation is making or producing sounds. This is where we produce our sounds. And within our pharynx, we have the vocal cords, shown right here in this mid-sagittal slice. These folds of tissue, this flap of tissue right here on the left and right sides of the larynx, are what make our voice. So, as we're looking at the superior margin of our larynx, on the superior posterior margin, it's the epiglottis. And here we can see an erect or elevated epiglottis. That epiglottis can go down, and it's the flap of tissue that's going to guard the superior opening of the larynx. At rest, it's going to be elevated so that air can go in and out of the larynx no problem. And that's a good thing. It allows for us to breathe easily. But when we swallow, we're going to have food push back against it, and we're also going to have some of the muscles help to pull it down, and that's going to cause the larynx to be pulled upward and the epiglottis to be pulled down to cover the opening. This prevents food from getting down into the airways. It closes the airway. Now within our epiglottis, we have vestibular folds, and these vestibular folds are also going to help to keep the food and drink. So we have a vestibular fold right up here, right next to where the vocal cord is. Sometimes those vestibular folds are referred to as the false vocal cords, if you have an older textbook. Those vestibular folds work together with the epiglottis to help keep food and drink out of the airway. They all work together in that respect. Now, as we look at the larynx, it has a lot of cartilage that makes up its framework. The epiglottic cartilage is the cartilage of the epiglottis, and it's going to be made of primarily elastic cartilage. So it's very flexible and can spring back into position. And it's going to be shaped like a spoon so that it catches the food as we're swallowing. We also have thyroid cartilage. The thyroid cartilage I'm outlining right now is the single largest piece of cartilage in our larynx. And this thyroid cartilage has a prominence on the anterior margin referred to as the laryngeal prominence, aka the Adam's apple. And what we find is that as testosterone levels increase in an individual, the thyroid cartilage and the laryngeal prominence of that thyroid cartilage becomes more developed. This is one of the reasons why adult males, generally speaking, have a well-developed Adam's apple, more developed than an adult female's Adam's apple, or laryngeal prominence. And we also are going to have a cricoid cartilage. The cricoid cartilage is a ring of cartilage around the inferior margin of the larynx. And this cricoid cartilage can extend upward. And I know I'm not emphasizing it on this slide, but there are other cartilages as well, such as the arytenoid cartilages, and those arytenoid cartilages, and then the smaller cartilage up there. These are cartilages that I'm not taking the time to emphasize. These are the ones on the screen right now, the epigloic, the thyroid, and the cricoid. Those are the big three that I really wanted to emphasize for you. On this slide, though, we're going to move into the smaller cartilages. We have 2 arytenoid cartilages, 2 corniculates, and 2 cuneiform cartilages. So as we look at these cartilages, we have the arytenoid cartilages located right here. And then we're going to have the corniculate cartilage as what I refer to as little vampire teeth on top of the arytenoid cartilages. And then we are also going to have the cuneiform cartilage. And to find that cuneiform cartilage, you need to look for a bulge on the lateral margin of the larynx. So the cuneiform cartilage would be a bulge, it's hard to see right here, but it's a bulge located approximately in this position. That translates to that bulge right there. Now, as we look at the ligaments that hold our larynx together, we have the thyrohyoid ligament, and as this name implies, this is a ligament that connects to the hyoid bone, hence hyoid within its name, and it also is going to connect to the thyroid cartilage. So between the thyroid cartilage and the hyoid bone, we have the thyrohyoid ligament. We also have the cricotracheal ligament. The cricotracheal ligament is going to be between the cricoid cartilage, I should say, and the beginning of the trachea. This first band of cartilage represents the beginning of the trachea. Let me clear the screen here. So in between the cricoid cartilage and the beginning of the trachea, I'm going to shift to bright red. We have this bright red cricotracheal ligament. It's kind of a tongue twister right there for your learning pleasure in bright red. So it's a very small ligament relative to the thyrohyoid ligament, which is much more pronounced. As we're looking at the folds within the larynx, we have vestibular folds and vocal cords. These superior vestibular folds have also been referred to as false vocal cords. I'm a little bit crustier, so I typically have learned these as false vocal cords right down there. And the superior vestibular folds help us to close up the larynx while we're swallowing. They don't actually make speech or sounds. We have the vocal cords right here, which we do use for speech to make sound. And these vestibular folds, or excuse me, these vocal cords are going to make sound when we have air pass between them. But we need to modulate the tension on these vocal cords. If we have them become stiffer, we have higher pitch noises or higher frequency noises, and if they become looser, we have lower frequency noises. These vocal cords are going to have the vocal ligaments in them connected to muscles that help to regulate the pitch of the noise that we're making. And to help protect those vocal ligaments, the vocal cords are covered with a stratified squamous epithelium. And it's not that we have lots of abrasion down there. I mean, hopefully nothing's rubbing against your vocal cords frequently. That would be really uncomfortable if that was happening. But what happens with the vocal cords is they vibrate. And because they vibrate so much, they tend to rub against themselves. And that's the abrasion they need to resist. So when you see that stratified squamous epithelium, think about resisting abrasion, structure and function. We also are going to have the glottis, and the glottis is very poorly shown in this mid-sagittal slice. The glottis is the opening in between the vocal cords right here. And that glottis can change in diameter based on the tightness or the amount of tension that's being put on the vocal cords themselves. As we look at the larynx in adult males, adult males typically are going to have vocal cords that are longer and thicker, which is typically going to cause them to vibrate slower compared to adult female vocal cords. Ultimately, this means that adult males are going to have a lower pitch sound. You probably noticed this. It's typically going to happen to males when they're in 5th or 6th or 7th grade when their voice cracks. And that's when their vocal cords are in the process of loosening in response to all of that testosterone coursing through their bodies. In terms of loudness, the volume of the noise produced by the vocal cords is going to be determined by how hard the air is pressing or passing over them. So if you move more air, you make more noise. As we look at vocal cords to make crude sounds, those crude sounds made by the vocal cords, I'm going to make some right now. Don't laugh at me. There could be things like, ah. I was only using my vocal cords right there. I wasn't using my tongue, my lips, my oral cavity. I was only using the vocal cords to make some crude sounds. We could take those crude sounds and form them into words by using the tongue, the lips, the oral cavity, the pharynx. And that's how I'm talking right now to you. I'm taking those crude noises and shaping them with the rest of my oral cavity to make words out of them. To change the pitch of our voice, we are going to change the tension on the vocal cords. By tightening the vocal cords, we have higher pitch noises, and lowering the tension on the vocal cords gives us a lower pitch noise. That's all we have for this recording on the pharynx and larynx. If you have any questions or comments, please feel free to post them in the class discussion board or to shoot me an email. And as always, happy studies.